Join the Blockit game room so we could start the review session for the lab. I know. Okay, let's begin. A lot of these are multiple choice and fill in the blank. What is K? What is the structure above the testes called? The lab final is going to be cumulative, and I just took a bunch of diagrams throughout all the lab sessions to into this review session. So take notes of what you guys are having a little bit hard time with, so you could go back and review them before the final. This structure is also where sperm is stored. It's called the epididymis. So if you are just joining, you could hop onto the game room. It's blookt.com. And then the game ID, the game room ID is in the top right corner. What is structure A? It's a singular, not plural, so it's just one of these. And this is where a lot of the blood vessels are. And when blood flows to it, it's what makes the penis erect. So what is that structure called? Kind of looks like a monkey face. It's called a corpora cavernosum, while the bottom one is called spongiosum. What is structure C? Right here, before all of the filtered leave, this structure is a kidney. So after everything's filtered, it enters this area and leaves the kidney. What is that structure called? Yep, it's a renal pelvis or a pelvis. What is structure K? So this is the female reproductive organ. K is the finger-like structure that is on the ovary. And then when the ovary releases an egg, it goes through these finger-like structures and travels through the fallopian tubes. Yep, it's called fimbriae. What is C? What is this organ? Right here, this pink one. It is always connected to this green one. Yep, it's the liver. The green one is the pancreas. No, it's the gallbladder. So the gallbladder is always connected to the liver. What is J? What is the top of the stomach called? In the stomach, there's a name for everything because sometimes people get ulcers on the top of here. Two. Yep. It's called the fundus. What is C? What is this muscle under your lungs called? So these are your lungs, and this is a muscle that helps you breathe. What is that muscle called? It is your diaphragm. The diaphragm is the muscle directly under your lungs. So this is your scapula. What is the structure on the scapula called? Kind of looks like a hole. Yep, it's your glenoid cavity. What is E? So these are all your glands, your saliva glands. There's three of them. And which one is E, the one on the very bottom? Yep, it's your submandibular gland. So now these are your abdominal muscles. What is these rectangular ones called that make like an egg pack? It is your rectus abdominis. What is F? It's a muscle on the back of your throat. Yep, it's your epiglottis. This is your venous system, your veins. And what is the biggest vein in your body called? It is one of the biggest because it's bringing all of the deoxygenated blood from your bottom half back to your heart to be reoxygenated. What is X? Now, this is your arteries. X is this artery on the side of your neck. It's a very highly pressurized artery. So a lot of times when like ice skaters and stuff get it nicked, yeah, the left common carotid artery, they could bleed out and die really quickly because it's so close to the heart. So it's super highly pressured. A lot of times in the movies, they always talked about cutting the jugular vein, but veins aren't pressurized, so it won't have as big as an effect as the left common carotid artery. But they're next to each other, which is why they're often mistaken, unfortunately. Okay, this is a very like thick structure. This looks like an artery. It is I think it's the second biggest artery in your body. It has, this is your lower half of your body. You can see the diaphragm muscle right here. And I think underneath it, this is one of the kidneys. And this artery branches. And then it's your abdominal art of aorta. What is A? What is this artery called? So we see the diaphragm again, and we see the kidney structures again. Which one is this one? And then we see the abdominal aorta. So what is this one called? Make sure you say like left or right. It is your right renal artery. Okay, this is a structure of your heart, a diagram of your heart. What are these called? Sticking out the side of it. They look very thick and structured because they're probably very highly pressurized. Yep, they're right pulmonary arteries. What is H? H is these muscles on the bottom of your heart, and they open the valves. They open and close them. They're connected to something even thinner that opens and closes the valves. They are papillary muscles. Papillary muscles are connected to the chordae tendineae that open and close the muscles. That open and close the valves. M. M is a structure on the side of the heart. Kind of looks like an ear. What is this structure called? There's two of them. Yep, this is the left auricle. C. What is your most anterior valve in the heart? What is that one called? The big two ones and then the two little ones. Your pulmonary valve is the most anterior. What is D? Okay, now we're looking at all of the cranial nerves. So this nerve has two of them. What are they called? Yep, this one's called the olfactory bulb, which is connected to the olfactory tract. What is P? So we're still looking at cranial nerves, olfactory bulb, tract, your optic nerve, and then all these other ones. But the one we're looking at is P. P is one of your biggest nerves in the body. Yep, it's your vagus nerves. What is A? The structure right here. We're looking at a cross section of the skull. You can see some white and gray matter from the brain, and this is a structure that divides the left and right hemisphere. All of these layers, but we're looking at A. What is that called? They call it like the rooster. Kind of looks like a rooster box cerebri. Oh, now we're looking at leg muscles. These are your thigh muscles. O is not a muscle, it's a structure. What is the structure called? Kind of pointing at the bone. What's that bone called? Yep, your patella. Patella sounds it's your bone and it sort of like moves around, but it's connected with all these ligaments. C. What is this muscle called? It looks like it originates from the iliac crest, as well as this muscle, this muscle, this muscle, and it's super thin. It is the tensor fascia latae. It's part fascia. You could see the top and the bottom of it. And fascias are like bundling the muscles. B. This is a lot of people's favorite muscle. It's one of the muscles people train at the gym. Also called your sitting muscle. There's three of it, but this is the most outermost layer of the three muscles that make it up. What is it called? The preschoolers that I work with love this word. It's very silly. It's a synonym for one of their favorite silly words. It's your gluteus maximus. Okay, M is you're looking at the superficial posterior view of the calf muscle. There's these two muscles, but M is the red one behind it all. What is that one called? It is your soleus muscle. What is E? One muscle is the frontalis muscle. See how the toes are pointing forward? This muscle is on the front. Tibialis anterior. What is G? It's one of the thickest muscles on your neck. If you palpate the interior of these corners, you could feel and take your pulse. So this is a good place to take a pulse. By the striate muscle on your neck. What is that muscle called? It's your sternonucleoid mastoid muscle. A. So these are your facial muscles that help make facial expressions. This muscle right here helps elevate your eyebrows, and deactivating the muscle depresses the eyebrows. So what is this muscle called? Your frontalis. Okay. Now we are looking at the forearm muscles. A, this long one right here. It looks like it's connected to your arm and your radius, and it is the most lateral out of all the muscles we see. This is your brachioradialis muscle, which is not an adductor muscle. Sartorius is not an adductor. All the others here are adductors, which originates from the iliac crest. Yep, your tensor fascia latae. All of the others do not originate from the iliac crest. What is not an action of psoas major? Psoas major is one of your leg muscles. Two of these are actions, and one is not. Yep. It does not adducts the thigh. What is A? So you have your scapula here, and then I'm asking for the muscle above the spine of the scapula. What's it called? Supraspinatus. What is C? C is this triangle-like muscle on the side on the shoulder. A lot of people train this in the gym as well because it makes your shoulders pop. Yep, it's called your deltoid. What muscle inserts at the shaft of the humerus? The coracoid brachialis inserts at the shaft of the humerus. What is L? L is these three finger-like muscles. That is deep. What are these muscles called? They wrap around your ribs. This is your serratus anterior muscles. What is D? Oh. D is this bone right here. You can see this is your rib cage, your sternum. And I'm asking for this bone. Yep, it's in your manubrium. The xiphoid process is the one that looks kind of like this, like a square with a triangle on it on the very bottom of that chain of bones in the center of your sternum. The eye. What is this bone called? Make sure you write which phalanx and which metacarpal it's part of. It's like you have to be extra specific so you don't misdiagnose a patient. It's called your middle phalanx, a metacarpal 2. If it's the one on the bottom of it, it'll be distal. Distal, I mean, the one on top is distal, and the one closest to you. So distal, middle, proximal, which is not one of the 8 carpals. The 8 carpals are the bones in your hand. It is capitulum. All 3 of these are one of the 8 metacarpals. I mean, carpals, except for capitulum. Capitulum is a part of a different bone of your humerus. Which structure is not part of the femur? Your acetabulum. And this is where the femur has the ball and socket. So the femur has the ball, and the acetabulum in the pelvis is the socket, which is not part of the humerus. Your olecranon is not part of your humerus. Your olecranon is your elbow. Which structure is not part of the clavicle? The clavicle is your collarbone. Yep, your sternum. Sternum means chest. The clavicle is on top of the sternum. Which of these are incorrect pairings? Yep. Anterior does not mean back, it means front. Which plane of the body pairing is incorrect? One of these have a wrong definition. Oh. Which one? Yep. Mid-sagittal means perfectly divides the body in left and right sections, but the oblique means across of it. Where is the pterygoid process located? Which bone is it? Yep, your sphenoid bone has the pterygoid process. They were like the four protrusions on the side of it. Which bone has the alveolar process? What's that bone called? The alveolar process are honeycomb shapes on a bone. Think about which bone has honeycomb shapes on it and why it has the same. It is your mandible. Your mandible has the alveolar process, which the honeycomb shapes are for your teeth, where your teeth are, which is not a paranasal sinus. So there's a bunch of sinuses on your face. There's one here, there's one here, there's two more. Which one isn't one of them? Your coronal. That is not one. What is the correct order of regions of the vertebral column from top to bottom? So like from your neck all the way to your tailbone. Yep, it's your cervical, thoracic, lumbar, sacral, and coccyx. This structure is not on the sacrum and coccyx. The atlas is not on the sacrum and coccyx. Which definition pairing is wrong? Ipsilateral means same side, while contralateral means different or opposite sides. Which facial expression and muscle pairing is wrong? Frontalis elevates the eyebrows. Remember? If you deactivate the muscle, then it depresses the eyebrows. So it doesn't really depress it. It's just when it's not in use. Which muscle is not of respiration? Which muscle do you not need to breathe? Use to breathe. Three of them are used to breathe. We talked about one of them earlier in this review session. Yep, the transversus abdominis, it's in your back, so it doesn't really affect your breathing if it is sore or something. Which is not a muscle of the rotator cuff? Yep, it is teres major. Teres major is not a muscle, but teres minor is. Which structure is not affiliated with the liver? The cystic duct is associated not with the liver. Congratulations. Thanks for playing the game. I'll be staying around for if anyone has any questions. Make sure you put your email in the chat so I could take attendance. And good luck on your final. It is your last one, the final stretch.